A major area of abnormality in the uterus is adenomyosis. So I'd like to address this at this time. This is a common gynecologic disorder that affects premenopausal women. Usually these women are over 30 years of age. They've had pregnancies. Sometimes they're postmenopausal women. And the symptoms are variable, which include menorrhagia, dysmenorrhea, dyspareunia, pelvic tenderness, sometimes extremely serious to the point of being debilitating, that during the menstrual cycle, the woman is incapacitated for a couple days and almost can't work. So it is a serious condition for some. And the prevalence varies. You can find different series. Look at this range. They range on surgical series from 5 to 70%, post-mortem series 10 to 50%. When you look at pathologic specimens, very often there will be a line saying adenomyosis present. So it can be present in small amounts or larger amounts. It's quite prevalent. It's a difficult diagnosis for us to make. It's an underdiagnosed condition in women. We are more and more aware of this and looking for better ways of diagnosing this. Years ago, this was not even a sonographic diagnosis until we developed better equipment, higher frequency, higher resolution, transvaginal scanning. We were able to start seeing things. And you always have to remember that you see what you know. So once we knew about it, we start looking for it. It is operator dependent. You have to do careful, meticulous scanning and using higher resolution. MRI has helped a lot in this diagnosis and certainly is a way to correlate and also heightened awareness among patients, clinicians, and diagnostic imagers. What is this adenomyosis? Well, this is actually ectopic endometrial glands and stroma that has gone backward into the myometrium, and as it has developed a focal site, it also has surrounding smooth muscle hyperplasia or hypertrophy around it. So there's two things that go with it. It's glands and stroma, and it's in the myometrium, so it's a focus of adenomyosis with adjacent smooth muscle hyperplasia hypertrophy. This can be in a diffuse form of foci scattered throughout the myometrium, and it can also be a focal, localized nodular aggregate that's called a focal adenomyoma. Sonographically, we're going to be looking for small echogenic foci islands, collections of heterotopic endometrial glands and stroma surrounded by this smooth muscle hyperplasia. And there are variable findings from solid to cystic areas, and we'll go through these. First of all, we may see asymmetrical wall thickening. Here we have a much thicker posterior wall than an anterior wall. Also notice that we have a fairly globular shaped uterus. This is the corresponding MRI scan, which shows us this markedly thickened posterior wall, these small little fluid areas, areas of bleeding. If you look carefully, you probably will see that there are little collections in this wall to correlate with the MRI. Another finding is heterogeneity. The echotexture of the myometrium is no longer homogeneous, but becomes more coarse. Here's another one that's globular, posterior wall is thick, but also notice this heterogeneity in the wall. The endometrial myometrial border may become indistinct to the point where you don't know where to measure it. Is this the endometrium? Should you measure it here? Should you measure it here? Where does it end exactly? So when you have that problem, you should think of possibility of adenomyosis. That can lead to this so-called pseudo-widening, where the endometrium looks too thick, and it's sometimes measured 2 to 3 centimeters, which and the patient has no bleeding, particularly there's no evidence of a polyp. And that happens because you have these confluent echogenic abnormal areas. Sonohysterography becomes helpful in that case. So when you think there's endometrial thickening or you're not sure, the sonohysterogram can help us. So look at this uterus. Areas blend. We can't tell exactly where the endometrium ends. We put in a little bit of fluid, and we see that the endometrium is completely normal. And this is then the area involved with adenomyosis. Another finding is very thin shadows emanating from nowhere in the myometrium. You trace the shadows back, and there's nothing there. There's no calcification, there's no mass. So probably these are coming from these areas of smooth muscle hypertrophy or hyperplasia that are near these ectopic glands. So these kind of shadows. Now these thin shadows have been described with fibroids. So it's also possible you have to stand back and see, is this coming from a mass, a rounded area as it was in this large fibroid, or is this coming just from the wall with no evidence of a mass effect? Okay, another manifestation would be seeing subendometrial echogenic linear structures emanating out from the endometrium into the myometrium. Here, for example. So this is a track of adenomyosis going into the myometrium. Here, another representation. This patient had a lot of pain, and here she actually had 2 small tracts that we could find. Sometimes it's just rounded areas, these sort of hyperechoic echogenic type of nodules. You can imagine that that's a pocket of blood or endometrium in the wall. And multiple small hyperechoic kind of nodular distribution is another finding of adenomyosis. And notice here you're having difficulty delineating exactly where the endometrium is. Another not that well described finding is seeing through transmission, increased sound transmission. There are areas of shadowing, but sometimes you'll see hyperechoic kind of, these are actually reverberations, probably from a little cystic fluid area of bleeding in the myometrium. So that then leads us to subendometrial cysts. There can be actual cysts formed, and some papers in the literature have described that these are not visible until menses commences, and once the woman bleeds, then they turn cystic when fluid gets into them, or blood. So that's a clue. So those are subendometrial, and here are myometrial cysts. Another finding, adenomyosis is the most common cause of myometrial cysts. Other findings in this patient, thickened posterior, in this case anterior wall, sorry, this is a retroverted uterus. So you have thickened wall, you have cystic changes, you have thin pencil-like shadows radiating, and a fairly globular appearance to this uterus. A pitfall here could be, at least for these myometrial cysts, could be a vessel. So in this case, it looks like a cyst, but remember, everything has to be confirmed in a 90-degree projection, and this is a patient I showed you earlier that has a huge arcuate vein underneath the outer layer.